engagement. We believe firmly in the power of a good education and in the power of someone who can walk alongside someone else and say, I've been trained to help you. We believe in that. We believe in the power of someone who can say, you know what, I've walked alongside people who are going through what you're going through for years. We believe in the power of professional experience. But we believe in the power and goodness that comes from someone who can say, I have been through what you are going through. I have stood in the line that you're standing in. Right? I have tried the things that you're trying. Right? I have suffered what you're suffering. We believe in the power of lived experience. We believe in the power that can only come from someone who can look you in the eyes and say, I've been right where you are. Right? We've probably all experienced that, maybe in a time of loss or in a time of pain or grief, where someone's come alongside us and put their arm around us and said, you know what, I know how you feel, I've been here. And we believe that there is power and there is goodness in that. And that is why we have committed this day, the entire day, to talking about consumer engagement and investing in consumer leadership, because we believe in that. My first experience of the word consumer engagement is a little nasty, but I'm going to tell it to you anyway, first thing in the morning. I was working in a domestic violence shelter as a children's counselor, and we received a grant that allowed us to provide all these really cool services specifically to children that were growing up in a family where domestic violence was a part of their story, right? So they would come to our shelter, it's a confidential shelter, and we would provide services specifically to the children through this grant that we received. It was awesome. But the grant said you're required to include an element of consumer engagement. And this was, 10, 15 years ago, we were like, what is consumer engagement? We had no idea what that meant. And so we talked and we did some research, and the grant funder said, well, what we mean is we want you to talk to people who have experienced domestic violence, who have experienced homelessness, and get their feedback, and have that feedback as part of the data collection that you do. Like, oh, okay. We weren't really sure how to do that, so we put the people, kind of above me, put a suggestion box in the playroom where the kids played, so we're going to collect suggestions. And I said, okay, well, what are we going to do with those suggestions, right? And they said, well, nothing, we're just going to collect them, right? Consumer feedback. I was like, The suggestions we received were, some of them were very, very good, some of them were heartbreaking, as you can imagine, from children who were separated from one of their parents and were in a place they didn't belong. It was just heartbreaking. We collected this feedback for 2 or 3 weeks, and it began to be clear among the families that we were serving that not much was happening with that feedback. We had some teenagers who came into shelter, and they were giving feedback, and one day I came in, and my office was right next to the playroom where the suggestion box was, and I smelled something real bad, to be honest, I thought, So that wasn't extremely unusual, by the way, but I went into the playroom to see, okay, what's going on here, and kind of followed the smell, and one of the teenagers had defecated in the suggestion box. And it was probably the clearest consumer feedback I've ever gotten. You know it? Because what they were saying to me very clearly was, this is a waste of our time. You don't care what we think. You're not doing anything with this. This is nothing to you. This is just, right? And it caused us to think a lot about how do we engage the experts in domestic violence? How do we engage the experts in homelessness, in extreme poverty, in crisis, in the crisis that can only come from being homeless? How do we engage those individuals? What do we do with the feedback that they give? Do we value the feedback that they give? I had someone tell me in a meeting like this, a consumer came to me and said, you know what, no one asks the opinion of the poor. Because we have been trained to believe that an expert is someone who drives a certain kind of car and wears a certain kind of clothing. We don't stop and ask someone for advice unless they appear to be successful by our own standards in Western culture, right? And so what we're going to talk about all day today is the fact that the experts, being an expert is not determined by how you dress or what you drive or how much money you make or where you sleep at night. That the fact that you've experienced something firsthand makes you an expert in that. So how do we ask the advice, receive the advice of people who have experienced homelessness and are receiving services at our agency. That's what we're going to spend a lot of time talking about today. So I want to start with just some announcements and some really important introductions. We are celebrating at our conference this year the 20th anniversary of the National Consumer Advisory Board. Woo-hoo! So you're going to be hearing a lot more about that over the course of the week, but we are truly celebrating that the National Consumer Advisory Board has been in existence, has been leading, has been guiding for the last 20 years. I'd like to start this morning by introducing our National Consumer Advisory Board Steering Committee members. These individuals are leaders in our HCH community. They're also going to be extremely helpful throughout the course of the conference. So specifically, if you're a consumer here today, if you have a consumer representative from your health center who's here, if there's any support that you need, any questions that you have, questions from where's the restroom, how can I get a printed copy of the registration information, to how can I build a cab at my local health center, we can't build a cab, what can we do? Any questions like that, these are the individuals that can help you. So if you are a member of the National Consumer Advisory Board Steering Committee, I'd like to invite you to go to one of the mics. You don't have to if you don't want to, but I'd like to invite you to go to one of the mics and to introduce yourself this morning. If nothing else, you can just stand. But do I have some steering committee members who'd be willing to go to the mics? Just say your name, where you're from, just so people get a good look at you. These are the experts in consumer engagement.
My name is Charlotte Garner, and I'd just like to say welcome. I'm glad to see everybody who's in here. On behalf of the NCAB Steering Committee, I am the regional representative of 6 and 8 from Houston, Texas. We are glad that you are here. We stand at the ready to assist you in any way we can be of service. I thank Cindy and the council for putting on and creating this space where we look at the expertise of those who acquired it through lived experience. Thank you.
Good morning, all. Welcome. My name is Rodney Dawkins, Regional Rep, 5 and 7, Skokie, Illinois. Heartland Alliance Health. Oh, and there's one thing that you can't forget.
Hey everyone, my name is Kendall Clark. I'm recently relocated to Atlanta. I was out of Newark, New Jersey for a number of years. And Cindy, this is one time, and I'll allow our work, I'm going to contradict what you said. The thing about it is that, yes, there are experts. We look at them for the way they dressed, homeless on the street. There are experts who their mode of transportation is the bus. So when you look at homeless people and you look at people who have overcome homelessness, just think they are the experts that you need to engage instead of those in the suits and the Mercedes. Thank you.
Good morning. My name is Paul Tunis. I'm from the state of California. I'm the co-chair for NCAB, and I was talking to, and if you haven't, I introduced myself. I was going to each table. I apologize in advance. I forgot all your names except Bonnie, of course. She reminded me. Anyway, I was talking to this young lady right here. She said, I'm an LCSW, and I said, well, great. I have a PhD in metropolitan street culture. She's like, what? Well, I'm an expert in homelessness, okay? So anyway, I just wanted to say thank you for all you guys. If you've attended this conference prior, this is your first time, welcome. I asked if you guys had a lot of business cards. Some of you said yes, some of you said no. You're going to meet a lot of people here, a lot of people, a lot of connections. There's going to be a lot of resources that you're going to be able to take back to your own area. So again, thank you for being here.
Hello, everybody. Oh, there we go. Hey, how y'all doing? My name is Deidre Young. I am from Houston, Texas, and I'm the chair of the National Consumer Advisory Board. Thank you. Oh, my God. But I really want to welcome you all, and I'm so glad you all are here. This is very valuable to the communities that we serve, and we pray that the information that you receive today will better help you in helping others. I just want to say that it was people like you years ago that got involved and wanted to make a change in people's lives. And one of those people got in touch with me
and helped me to get where I am today. So I thank you all. And I was speaking to someone earlier, and he sounded so down about the problems that's going on. And I wanted him to realize is that, you know, we plant the seed. You all plant the seed. Somebody else is going to come along and water that seed, and it's going to grow. And it was because that was done for me. So I just want to thank y'all, and y'all stay encouraged.
Hi there, I'm Michelle. I'm from Seattle, Washington. There we go. Is that better? Hi there, I'm Michelle. I'm from Seattle, Washington. I'm here. Go Seattle, right? If you have any questions, ask me. I didn't realize there was a speech. I was not prepared for this, but I'm here on young adult homelessness, young family homelessness. So if you have any questions about lived experience in that area, I'm your person. Come on through.
Good morning, everybody. Okay.
Mic check, 1, 2.
Well, excuse me, miss. Good morning, everybody. I'm Warren. I represent the Boston region, and this is a beautiful turnout. So I thank you guys for encouraging me to do what I do best. And I hope that everyone in this room takes back good education, good knowledge to your respective organizations. And I look forward to working with all of you. So let's get it in.
What are we doing?
We're doing introduction.
Hi, my name is Christina, and I am from this Seattle, Washington area. Thank you.
Hello, my name is Myra. I am from Denver, Colorado, and I'm a member at large. I'm just glad to be here and help other consumers do what they need to do so they can progress. Thank you.
Anyone else? Apparently, we cannot go on until you introduce yourself.
Good morning. How y'all doing today? My name is Joe Benson. I'm out of Houston, Texas. Everyone know me as Cowboy. I'm a past chair of the National Consumer Advisory Board. I'm a past chair of the Consumer Advisory Board in Houston that we call the Change Committee. I now sit on the Clinicians Network because for the past 11 years I've been a community health worker. And I'm also a mentor for the National CAB. So if you have any questions, look me up. I'm a talker, so you might have to stop me from talking. So, and we'll go from there. Yeah. Y'all have a great
And hello, I'm Valerie Dow from Cincinnati, Ohio. And so let me just say this. Joseph and I are mentors to the Steering Committee. That means over 15 years. So we've been around. We've been around. So thank you.
Do you want to introduce yourself as you walk in? We just had all the steering committee members introduce themselves.
Hello, everyone. My name is Cynthia Iverson, and I'm happily from Miami, Florida. I've been with the NCAB for the last 3 years. Thank you.
Woo-hoo. So as you can see, we have a group of amazing people that you can learn from, talk to. I encourage you to sit up. Art, you want to introduce yourself? You came just in time. Mamie, you too. You want to introduce
I'm
yourself?
a little louder than the microphone, but hi, my name's Art Rios. I'm from Central City Concern, Portland, Oregon. I use they, them, those, he, him, his. I've been with NHCHC since 2002, so I'm a veteran. I'm also the past chair of NCAB. I'm mentoring Deidre Young. My mentor was none other than Rodney Dawkins. Also with Amy Grissett that's not here, and also Cowboy that's here. So I've had to fill some big shoes, and now somebody else gets to fill those same shoes and stuff like that. But I'd like to say welcome to all of you here.
Morning, my name's Mamie. I am a membership at large 2-year, and I'm from Portland, Oregon.
I would encourage you to reach out to one of these individuals, sit with them at snacks, at lunchtime. We're going to give you a lot of information today. They're going to be sharing information with you, but information that you would glean just from conversations with them will be invaluable, where you can ask them questions. So you can see there are a whole lot of individuals here that really are experts, not just experts in homelessness. The individuals that just introduced themselves are experts in homelessness, but they are experts in helping people who've experienced homelessness rise to a position of leadership. Right? That's what they're experts in, even beyond just homelessness. So I encourage you to reach out to them, especially to ask questions about how consumer engagement can be practically applied to your specific agency. I'm going to give just a few really basic announcements, and then we're going to get started this morning with our content. So we introduced our NCAP steering committee members. You had breakfast downstairs. I want to invite you to our National Consumer Advisory Board business meeting, especially if you are someone with the lived experience of homelessness and you want to learn more about NCAB. We will have a business meeting on Wednesday morning at 7 a.m. in the Waterview room. If you would like to join NCAB and be a voting member, you can do that using the app, and any of us can help you with that. But that business meeting breakfast is a place where you can come and learn more about NCAB, and it is 7 to 8:30 on Wednesday morning in the Waterview room. Let me go ahead and introduce our staff who are here as well, and they can assist you with anything that you need with the conference, as well as talk more about consumer engagement. So if staff wants to stand, my name is Cindy Manginelli, and I'm the Director of Community Engagement with the National Healthcare for the Homeless Council. This is Kayla. Hey, Kayla. Kayla is our Community Engagement Coordinator. This is Meredith. Meredith is our Consumer Engagement Manager, and this is Sandra Mooney. Sandra is super popular. Sandra arranged the travel with some help from others, but Sandra pretty much arranged all the travel for all of our steering committee members. So Sandra's still alive after that. So if you need any travel agent kind of help, Sandra can help you with that too, as well as consumer engagement. So feel free to come to any of us if there's anything we can do to help you today. We will have a break at 10, from 10 to 10:30. My understanding is there will be refreshments. I've said that before and there weren't, but that's my understanding. But we'll have a 30-minute break at 10. Then we'll have lunch at noon, and lunch will be an hour, and lunch is provided here today. Sometimes if you've been to a PCI in the past, we went out for lunch, but lunch is provided here at noon. And then we will have another break this afternoon at 2:30. So we do have breaks throughout the day, but we encourage you to do what you need to do to take care of yourself. There are restrooms. There are non-gendered restrooms right outside, literally just across the hall. I'm looking at them from here. If you prefer a gender-specific restroom, there are some of those on this floor. You just go back to the other hallway. The hallways here make a big U shape. And so if you go to the other side of the U, you'll see some gendered restrooms, and then there are also gender-specific restrooms downstairs where you went in for registration. We have a few other consumer-specific or consumer engagement-specific activities at the conference. Specifically on Wednesday, you'll see things all through your agenda, you'll see several sessions tomorrow and Wednesday. One that's specific that the NCAP Steering Committee helped to do is our CPO, Consumer Participation Outreach Session, which is on Wednesday at 2:15 in one of the Laurel Rooms. You'll see it on your schedule. If you want to learn more, see what we're going to talk about today in action, where our NCAP Steering Committee actually conducted a survey, they wrote it, they delivered it, they analyzed the results, and then they're going to be talking about what they learned and also how to apply those results. At 4 p.m. today, we will be done. And if you are a consumer, you are invited to stay after 4 p.m. Deidre, who you met earlier, our NCAP Steering Committee chair, will be leading a very informal session in here where you can have questions answered, you can speak with the mentor you've been assigned, we can answer all sorts of questions, anything that you need, beginning at 4 o'clock today. Just stay in this room when everyone else is dismissed. Anyone is welcome to stay if you'd like to see sort of NCAB in action. But if you have any questions, any concerns about the conference as it unfolds, any questions about NCAB, you're welcome to stay at 4 o'clock today, where Deidre will lead a fairly informal session. We are so excited about this many people who pay extra money to come and talk about consumer engagement. This many people who at least are interested in learning more about how people who are experiencing homelessness can inform the work of ending homelessness. That's what we're all about today. So I'm super excited. If there's anything we can do to make the day better, please let us know. I am incredibly excited to turn it over to Valerie Dowell. Woo!
Okay, I'm gonna stand right here just to get us started. So I want everybody to stand up. Check your hips. Okay. Okay. Look to your left and introduce yourself to whoever you see. Look to your right and introduce yourself. Or just introduce yourself to someone around you. All righty, if we could get started. Everybody has introduced themselves, got name, contact information. We're going to get started with the next part. So now we're going to allow Myra to share her story on leadership development and working with the Healthcare for the Homeless program.
Hello, everyone. So, like she said, I'm Myra Nagy. I started my consumer engagement a long time ago. When I first got unhoused, I was trying to learn the system. I had people helping me, and then I realized there was a lot of people that didn't know what they were doing, how to find stuff around town. So I started collecting resources and sharing the resources. Of course, in the homeless community, the first thing people do is tell the word of mouth, like you go over here if you want the good this, or you want the good food, or you want the good resources. So I started sharing it. And that was my first consumer engagement. I didn't realize that's what it was. I thought what it was just sharing, information with people that needed it. And then I did that for a while to where I became the resource lady. They give you labels like that, and Mama Myra and all that kind of stuff. Then and when I got housed, I really got involved. I became the computer lady or the tech lady, but I was still handing out the resources. Anytime I heard anything about resource for anyone, I made sure I collected it and saved it on my computer and everything, so I could say, as soon as somebody say, I need help with this, I need help finding a case manager, I need help getting into my, my clinic or whatever they needed, I was like, I know how to do that, let me lead you there. And I would start helping people. And then I went through a bad time. I had some substance misuse issues, and then I came out and went into recovery. Thank God for recovery. It helped me through my process. Then I realized I needed a purpose. I thought I already had a purpose with, resources and stuff, but it wasn't enough. So then I started doing more. I was like, let me join my cab. My chair of the cab at the time is the one that was helping me through my recovery, so it was easy to get started. So she helped me through that. I started going along with her, and then I realized there's so much more I can do. I can help everybody. Well, at least I thought I could. So I started going to the cab, learning how I can help people and reach out, and then I became the chair. And then I started doing more, like coming to this conference. I mean, my story, I'm trying to make it short, so I'm not taking up all this time, but I realized that, there's so many people out there that don't have a voice. They don't know how to speak up for themselves. They don't know how to talk for themselves when it comes to, well, you know what, I wanted to talk to my doctor, but I was afraid my doctor was gonna be mean to me and tell me what I needed to take and how to take it. So I teach them how to talk. I say, well, just tell them that that's not what you're happy with. Just let them know that, how you feel, how you're telling me, tell them the same thing. So then I started doing that more and more, and now I've been coming to the conference for a few years. I've been able to share my story with other people, because sharing your story is the most important part, because when you're able to talk about the bad times and the good times and everything in between, then people get inspiration to do the same thing. And next thing you know, they're leaders. So that's a little bit about me. Anybody have any questions, or I don't? Oh, thank you. I don't know who said that, but thank you.
So let me ask a question. How many are consumers? How many are providers? Okay. I just want to take the temperature. I just wanted to know who I'm talking to. So, Myra's story is a lot like a lot of our stories who do the work. One of the things that I did once I got clean and got a job, I wanted to work on different platforms. So I worked with the homeless. Then I went to the government and got a job. Then I went to the city because I wanted to see how homeless individuals were treated on various levels. And the important for me was to make sure their voices was heard on every level, not just in the homeless community, but on the government level, on the city level, on the state level. So in doing this work, have you encountered anything like that from the coalition?
So I did encounter some of the stuff, and city and government. For example, I've been involved with some of the, the camping ban. That was one of the things. I actually was unhoused during that time. And when the camping ban hit, I realized we didn't have nowhere to go. And see, they didn't have a lot of women's shelters. So then I realized that we need to find a way to keep the women off the streets, stop being swept. And so that was one of the situations. I've also experienced a couple other ones, here and there, but not a lot of it. I'm just starting to learn now, now that I've been a part of CCH, which is Colorado Coalition for the Homeless, that they can teach you how to be a lobbyist, teach you how to advocate, and be a part of that. So that way, when there's bills come out that help the unhoused, that I can participate and actually understand what I'm doing. So now when there's bills, and I try to share the information with unhoused people, make sure they're registered to vote so they can participate in that kind of stuff.
Okay.
Yes.
Everything you're saying sounds incredibly inspiring. When you were unhoused, how did you find some of those resources that were truly beneficial for you? We come across in our population a lot of people get scammed a lot, and it's really hard. And then also, my next question to this is, how do you overcome your stigma and what resources? Because this is a huge barrier, is the stigma that is placed upon this population, and it's just incredibly heart-wrenching.
I'm gonna start with the first question if I can remember it. So, finding the resources. First of all, I needed somewhere to sleep. And then I just happened to meet this one guy that wasn't about scamming. His drug of choice was coffee, and I loved it. So all he cared about is where to get the coffee. He spread that information, and he just pointed out all the places for me. Then I realized that everybody had a different version of what was the best places were. So I started collecting the information so I can know the best places for me, because I had to do it tailored to my own needs and whatever I needed. So that's how I started off. And then I realized there was a lot of women women that really needed specific things. So then I started asking, like, well, where do you go for women? I'm not shy. I mean, well, I'm shy right now, but I'm not shy when it comes to asking for things I need. I'm a go-getter. So a lot of go-getters are the ones that become leaders at first, because they don't have a problem with, like, look, I need some of that bacon, I knew you were probably going to say no, but you know what I mean? I don't mind asking. And so that's what helps you through that process, And then you had another question, I forgot. Don't ask for your bacon? Okay. No, my stigma, I think I was going through trauma. I was suffering with PTSD, so that was my main focus, was like, don't let anybody know that I had PTSD. Had some guy die on my couch. That's what started my homelessness. And so I was trying to suppress that. So the rest of the stigma, being homeless, I dressed like normal. I made sure that I would look clean, my clothes were clean. I went through all the trouble to make sure that I didn't look like the homeless person. I had a cart. When I realized that I was camping out and I had sleeping bags, I decided to get, I call it the grandma cart, where you go grocery shopping. So that's how I started off, because my boyfriend at the time, he wanted to push, the Home Depot cart. I was like, no, we're not doing that. So that's how I changed it up. I made sure that I had the persona, but that was part of the stigma. I didn't care that I looked homeless. I didn't care about that. I cared about what I needed and getting the resources so that other people could feel comfortable about their resources and what they needed.
So Myra just said something. What does homelessness look like? What does it look like?
So I find that question a little offensive, because stigma is for those people who are looking at us who are homeless, not us who are homeless. We're living with that day to day to day. I started off homeless 5 years ago. I came out of homelessness, but for them and there, here and now, I dress the same, I look the same, I talk the same. When I go to places, if you think I'm homeless, that's on you. I'm still going to go to my resources. If you're going to stigmatize me, then you're going to be racist against me, you're going to be sexist against me, all those other things. I think it's for providers to come out of that shell of stigmatizing people. Not for us who are homeless. We need the resources. You have the money and you're getting the money. Give us the time and day. Thank you.
Yeah, it sounds like you're saying that instead of saying it's a stigma, just look at it as like the next, like your sister, your brother, and treat us like that. You had a question?
Yeah. Let me get her real quick.
I was just going to say that for a really long time, I didn't step up and talk about it, and I didn't advocate for anybody else but myself because I was in survival mode. And the way that we can destigmatize it is by changing the laws. That is the only way, because every single person in the country, around the world, can be homeless at any time. And until people understand that, we will always carry that seed of trauma because we've experienced it. And it's up to us whether we continue to weed out that weed, because it's a perpetual, you have to continue to work on it because it's a wound and you got to take care of that wound. But if you let that seed grow and you let that weed grow, it turns into a really horribly infected oak. So you work on that weed, you continue to work on yourself with your care team, You do the work out. Once you take care of you, because that's the first thing, then you can help your neighbor. Then you can help the community. Then you can help the city, the state, and then federal. But you gotta be on okay with you, and then you can help everybody else out.
And so let me just say this about what she said about the stigma, and it starts at the top. So who determines what is homelessness? It's the federal government. So it goes back to what she said. But these are the kind of places and spaces we need to be getting into. We need to get in those spaces where we can help determine what is homelessness. Let me let April say something.
Okay. After 18 years of homelessness and 8 years on my local cab, we had problems with the stereotype of people in our community thought that the homeless were criminals, drug addicts, just didn't even count for human beings. We, as gals and I, we went to various members groups for neighborhoods, and we stood up and spoke at those meetings that were at neighborhood groups and said, look, we're houseless, we're not homeless. We have a community, it may be an encampment, but we have a home, and we really are insulted with your stereotype of what we're about. And we went to these meetings repeatedly throughout Oakland, and it changed things. We came back, they developed groups of people that would go out and do a Sunday brunch, or they do a monthly cleanup, or they did a winter donation. But we totally gave them a 180 on what it was about, and it made a big difference.
Thank you, April. Let me get her, and then Joseph.
And I think that's so important that we are able to educate the leaders, because their intentions are to help, but some of the times, the way they help, it's not adequate. It's not proper, and it makes a person, just feel low, stigma, So it's like you said, we need to identify in the government level, especially for an FQAC, what is considered homeless? Is it encampments? Is it doubling up? How do we help those individuals? So I'm a director for Migrant Health Services and Outreach, and we have the resources and the questions that we have to ask, SOGI, for all of our patients. But a lot of people do not feel comfortable asking those type of questions. So my question is, what have you guys come up with a PowerPoint? You are the consumers, you are the experts, to be able to, person like me, bring you in through a Zoom, and hey, let's talk about this through our corporate staff, because one person is not enough. You know what? I want to make an impact, but it's not enough. Why? Because there's no time, there's no staff, there are no ideas. How do we address this? All of a sudden we're asking for, extra restrooms. We're asking for changing, your pronouns in a signature, So what I'm here for is to get that, empowerment from you guys, and just ideas, or even create my own cab down south. That's why I need you.
So let me just say this really quick. Everyone have one of these on the table. These are for questions. If you have any questions, write them down, put them on the table. If you don't want to leave them on the table, we have Kayla right there. You can leave them with, and we have Meredith, and we have Sandra. Okay? Put my name on whatever it is you want to do. Okay. Go ahead, Joseph.
It's unfortunate the way that the community look at homelessness. And true enough, we have to change the policies in order to get that done. But in order to get those policies changed, we have to go to the grassroots. One of the things that we have amongst the NCAB is called storytelling. We have to have those individuals to go out to the grassroots organizations, to the churches, to the different committees, to city council, to let those people know that we want to change the way you think about homelessness, because what is unfortunate is that the general public, when they look at homelessness, they look at the severely mentally ill. They look at those individuals that's walking around with dirty pants and dirty shirts eating out of the trash cans. But most of the people that I know that's homeless, they take showers every day. They put on clean clothes. They carry these backpacks and they go to work at the labor pools where the labor pools overuse them, don't pay them enough money so they can get a place to stay. So these are the things that we have to work at. And the other thing that hurt the homeless community is those individuals that take the way that the mentally ill dress and then they go stand on the corner and fly those flags. Most people I know that's homeless, they are afraid to fly a flag because every once in a while the police come around and do a sweep and you go to jail and they can't get out of jail. So they don't do that. You know, and we need to be able to change it amongst the general population to get them to understand the different levels of homelessness and the difference between an individual that's homeless because like my state, Texas, they opt out of Medicaid. Or individuals that had a medical problem that they lost their job and didn't have no backup as far as savings in order to get in, then they wind up on the streets. You know, it's different ways to get people on the streets, you know, but you have to change the perception. And the reason why I say that, and I'm gonna say this and I have to stop talking because I'm looking at Valerie, but a few years back, 60 Minutes did a thing on individuals that flew flags. The person that they chose, he lived in Staten Island, New York. But where he worked at was on the corner of East 56th Street and 7th Avenue, which is Fashion Row. This guy rode from Staten Island to where he worked the corner in Manhattan every day in a limousine and rode back home in a limousine. He averaged $175,000 on a year. And that made it look bad on the homeless community because now they have given the politicians and other folks say, oh, look at them, they don't want to work, they just want to stand on the corner and beg for money. And that's not a homeless person that's doing that. That's a person that should have took their behind and went and got a job. I'm through. But let's change the way that people think and look at homelessness.
Yep.
Hi, I actually have a question for you, kind of on the other side of stigma. How do you handle being like idolized or up on a podium, coming from where you did and doing what you do now? Mm-hmm.
So speak up a little loud.
Sorry. My question was, how do you handle coming from where you did to where you are now and feeling like people put you up on a podium, or kind of like because you joined the other team, you're no longer a part of your own sort of like thing? Do you ever?
Yeah. So let me just say a little bit about that. I'm gonna always be a part of the community. So what I do it in my work. I'll never move from the bottom. I don't want a desk job. I don't want to put on a suit. Not every day I don't, but I will. But I stay connected to the people where I could understand and know what is best for them. I don't want nobody to tell me. I want to see it. I sit down with them. That's the work I do every day. I'm 66, and I'm still working. I'm going to continue to do the work because it's so rewarding. And I hate to say the word homeless, but it's really unhoused. I don't say encampments, I say communities. Because when they disrupt something, they're disrupting a community of people. It's not encampments. Those are government words. Okay.
Yeah, this is a real hot topic for me. When you were doing the introductions as far as who's a consumer and who's a provider, I was waiting for the both, and I am both. I am in long-term recovery, and I have lived in homeless shelters. I've lived outside of homeless shelters, and I'm now a program manager for an NHCHC in Rochester. I think if we're doing things really effectively, there isn't in us versus them, whether we've had that experience or not. I think that, you know, we have our Consumer Advisory Committee that reports to our board of directors. They don't report to anybody else. We are constantly holding focus groups. We want to be in line with the consumers that we're serving. And I think that if we're doing it, I don't want to use the word correctly, we are there shouldn't be a stigma of, you know, of someone who's homeless. That if we're out there truly representing consumers, I don't see it. When I'm talking to people in our community and in the government, I don't allow for it, so maybe I'm naive and I don't see it, but I think that's I think that's what we have to present. If we're confident in what we're representing for our consumers, that it's going to be a big step in overcoming any stigma that someone might have. The other thing is hiring. What we do as far as hiring our providers, we used to do the generic, okay, we need a physician, we need a nurse practitioner, we need, you know, an account exec, whatever. We do things differently now, and we hire people for heart and for mission and for passion, not for credentials, not for experience necessarily. We hire for heart to make sure that people are out there representing our mission in a way that we want them to do it.
Yes, the question, I would like to respond in this way. I think everybody is looking at me right this moment because I have the mic and I'm speaking. Well, this is what homelessness looks like. I just want everybody to know that it's an individual journey that affected a collective group of people. But they are individuals at different processes with different backgrounds, which is where the story is. It's not about where we wound up. It's about where we came from and where we're trying to go. So whether you stigmatize, categorize, analyze, whatever it is that you choose to do, because we do it in any and everything that we do. It cannot be used for a crutch. It cannot be used for an excuse for a lack of progress. It cannot be used for a defeated attitude by a provider that it doesn't matter what I'm doing, this is just the job. Everybody has to realize that it looks different because now you have two schools feeding into the homeless sector. Those displaced that were high-functioning people, that were victims of downsizing, that were victims of catastrophic events, whatever the case may be, they wound up with us folks, okay? So being as we have those two schools, which I would play off and represent as side one and side two, there's a blended society now of people that bring unique gifts to the table. Those are the pieces that you look for. It doesn't matter what I look like today. What you need to remember is I can look like something different tomorrow if everyone has the attitude that I can understand I can.
Oh, where?
McDowell, let me throw a word in real quick, please. First and foremost, for those that are consumers, keep doing what you're doing, okay? Stand your ground, be firm about it. To the providers, I must say this. Take 30 seconds out of your so-called schedule or lifestyle and put yourself in our shoes. Look at it from our perspective as a patient, as a consumer. I've been doing advocacy for the disabled community for well over 20 years. And I'm here to tell you, at the government level, all we are to them is a statistic. So the more we show up and the more we show out, we're going to make an impact. One way or another. We've been doing this for 20 years. NCAB been doing this for 20 years. So think about that for a second. 20 years going to the front line, telling these people that run the government, yo, this is what we want, this is who we are, and this is where we're going. If you can't get to that, then I don't know what to tell you. But I'm here to tell you as a consumer and as an advocate, do not, by any means necessary, let them tell you anything different.
Okay, hello everyone. Well, I'm going to answer the question of what does homelessness look like, but throughout my whole career, for nearly 27 years, I was working for church folks and politicians, so you use that as a sleeping pill. But one of the things that I've learned, and I'm very successful, but one of the things that I've learned is that homelessness has no face. How many of you don't know that the person sitting next to you is actually living out of their car and dressed very well? How many of you don't know that the clothes that they have on that they didn't get from the Goodwill, which I think is a very nice shopping place, right? It didn't get from the Goodwill. So I say to you, the next time anyone come to you and have a person of homeless you have to assess, before you grab that intake form, sit down and talk to them. Not at them, sit down and talk to them. And believe me, before you end that conversation, everything you wanted to know in that intake form, you will have at a level at which they're opening up their heart and they're telling you, hey, this is not my fault. And I implore you to do this simply because right now, with the pandemic, a couple of weeks ago, they said it's no longer an emergency, no longer an emergency. We're going to get the after effect of those people who are homeless, those people who are really struggling right now after the pandemic and really is like a month away or paycheck away or 3 months away from being homeless. We're going to have to encounter those people. So I ask that you definitely don't look at them as homeless. Look at them as a person, and you have to individualize that need. Look at your toolkit, look at your policy and procedures, look at your standards. But when it all comes down to it, you're going to have to individualize that need and not cookie cut that person into that situation, because everybody who's homeless, for whatever reason, is different from each and every other person you can. You might have two people that have the same homeless status, but those two people have different situations. And I beg you, please individualize them. Don't cookie cut them. And I guarantee you, you'll have a better outcome and more success in their upcoming.
Hello, I'm Dante Lartica. I'm from California. Hello. So, yeah, just hearing everybody speak, you know, that's the beauty of being people. We have our own perspectives. And, you know, our experiences shape our outlook, if you will. You know, I ended up homeless as a child with my mom, sleeping in hotels and a van, stuff like that. And then I came into foster care. And when I came into foster care, they separated me and my siblings quite early on. And so that, you know, led to a host of behavioral issues, if you will. They'll label it whatever they want. And then, you know, I'm stigmatized with that, you know. And then, you know, as I emancipated, I got more involved in this work. And through this work, the reason why I got involved is I ended up homeless as an emancipated youth quite quickly. Within, like, you know, a month of me turning 18 and graduating, my foster mom said, hey, you got to find somewhere to go. So, you know, that was the journey. I had to find somewhere to go. This system that I guess is my parent didn't have a plan for me, right? And that's where, you know, that resentment kind of turned back on again. For a while, I was kind of starting to give the government a chance, if you will. But when we talk about this versus us type of thing, I think that's where, for me, it becomes very, very like important to understand. It almost is, right? Like, no matter how we see it, someone just said it. They see us as a statistic, a data point, an outcome. And you try to change those things. I worked in the government for 6 years for Department of Family and Children's Services. Couldn't, I was a wheel in the cog, or a cog in the wheel, if you will, right? I couldn't change much. But what I will say is someone just said, hey, I'm both, right? And that's what I encourage us all to be, is both. I'm a consumer and I have my own nonprofit. I started from the ground up, and so when I saw Myra this morning, that was the light of my joy. Why? Because I think it was last year or maybe 2 years ago, we met each other, and she said, how do I do this? Like, how do we figure it out? Like, I said, you got to do it yourself. Like, if there are allies out there, they will find a way to you, right? But you're going to have to do what you're already doing. And many of us are doing that. We're something like you said, hey, I'm out here. I'm going to always be on the ground. I'm always going to help my brothers and sisters. And ultimately, I think that's what we have to do across the whole nation, is literally organize and build formations or collectives, but build from the ground up. Like, as service providers, as advocates, we're already advocating, we're already doing policy, but we already are service providers. We're just not formally bringing it together, right? And the one thing that I think in California that is the challenge is our government, they don't listen to us per se. In my viewpoint, who they listen to is their constituents that pay those high property taxes, right? And so typically those are NIMBYs, right? The average home in my neighborhood is $2.5 million. They're not listening to my little old self. So what I had to do was build something that they would have to come to. I had to build my own table, which is outcomes with my brothers and sisters. And now they're saying, hey, how can we help you? How can we support you? I don't need anything but the money that you got, right? No, seriously. I'll get the outcomes. Why? Because we're proximate. We're intentional with the work we do. But ultimately, these are my people. These are my brothers and sisters. And it's based on respect and loyalty and understanding, right? So, again, I applaud all of you for being here. And I hope that all of you know you are the solution. Every single consumer in here, you're the solution to this problem that we have around the nation, this epidemic, if you will. You're the solution.
So thank you. I have one question. Based on everything that everyone shared today, take this and let's build something. Let's see what we could build. What do you think? You know I'm gonna come to you. What do you think we could build?
Well, I'm looking to learn how to build a consumer advisory board for our team. That's something that I'm working on with a couple of my colleagues right now, and I'm really excited to find out more from people about how to make that happen.
You see them people over there? Look at them looking at you. That's who you talk to. What do you want to build?
I think building a community of people who have understanding and education and support of one another, both lived experience and of that community is going to be really important. And I think we don't have an advisory board either. A consumer advisory board either. So, hi, ladies, gentlemen. Thank you so much.
I'm gonna pass the mic. What do you want to build? Nothing.
I want to say, like, consistency. I want to build more consistency with, it's really important to meet people when you say you're going to meet them. And I don't see that a lot from some of our new colleagues that we have, at my health center, but I want to see that more because that's really important. When you say you're going to be there, you got to be there. Because then you build that stigma, that provider's not going to be helpful. They're not there. They're not there when they say they're going to be there. So I want to build that.
Good morning. My name is Christy Ward, and this is my colleague, LaWanda Pack. She's crying, but I'm going to go ahead and speak it out.
Thank you.
We are like the go-getters from where we are. We are in Palm Beach County, and there's nothing in place for our homeless people. Our unhoused people. So the thing is, I have an issue with that. I go to city meetings. They don't like me there. I don't care. I go to different churches with different pastors and stuff, and it's just still not a movement. It's too much talking, and I'm not a person, we gonna keep talking, we ain't got no action. So I have an issue with that. So like me and my mom or different women, we get together, we'll feed you. If we can cook, we gonna feed it. Whatever we got, whatever we can do, we try to do and get resources. And what I'm trying to do, as far as Palm Beach County goes, we want to put the face of unhoused to people. I'm gonna change that. It's gonna be changed in a minute. So the thing is, it's just like we got kids even going to school who are unhoused. I got a problem with that. You know, if it doesn't mess with your sleep at night, that's a problem for me. And the thing is, it's like we have all these different things that try to come in place, but they, like the young man said, I don't need nothing from you but the money. Because the thing is, they try to come in and make it their own thing. And that's not what we're not trying to do. Because the thing was, we built trust with these people. And the thing is, the only thing you want to do is consider them as data and information. Stop it. Stop it. They are a check, people are a check away from being without. And this is why when I go into these meetings, I let them know, listen, you put all this stuff in place, but you're gonna have to live in the very thing that you're trying to put into place. So don't think that you are exempt, because we're never exempt from anything. So today, we're trying to learn all we can, because we need to make this happen. And like one of my bosses said, he said, ain't nobody gonna help us but us. And that's what we got to do. I got to look out for I am a minister as well. So I have to look out for my brothers and sisters. I don't see color. I don't see none of that. I see you as a person. And that's simple as that, because it could be my kid, it could be my family, or whatever. So what we want to build humanitarianism. We have lost our humanity. I love all y'all and don't even know y'all. I love all y'all, and that's the way we gotta get. We gotta get to the point where we're not looking at people like, oh, they must be unhoused. No, help. And they say you see something, say something. If you see something, do something. I'm so sick of the phones coming out, y'all not doing nothing. Help. People need help. And I'm so upset when people be out there and they take advantage of this. Because now people are second guessing, should I give or should I not give? I see it all the time. We got a whole family. They even bring their kids out there. I'm just like, are you serious? But we want to get to the place. Palm Beach County want to get on the map.
Okay.
Broward County want to get on the map. We want to get on the map.
That's Florida,
so
right?
Help us, because we need to get on the map.
There you go, right there. Connect with her.
Thank you.
Anybody else back here?
Hi, good morning. My name's Paul. Hey, how you doing there? I'm hearing all this great information, and how can we? And I'm just wondering what's the solution to at least minimize or end our homeless population throughout the country, right? And coming from both sides, being a consumer and being a provider, our policies that surround services to support our homeless communities are based on these middle-class value systems, right? And I'm not saying it's a bad system, right? Being a good mother or being a good husband or a good parent and picking your kids up from soccer practice or going to church once a week, working a 9-to-5 job, right? Those are all good value systems. And what we fail to see is that we forget to see the value system of the folks we're serving, right? Because as many of you are saying, it's a checkbox, right? We don't want to put a numerical value or a checkbox to a human individual. But I'll tell you a story. I was working as a case manager, working with a family, and she was through what they call rapid rehousing, right? She was doing really, really well. She had her kids in daycare and was through a funder through the First Five funding. And the idea is for folks to go through this program and assume the lease after a period of time. So she had her kids in daycare, which was actually funded through another organization, and she got a raise, right? So she got a raise, like a $3 raise, and she had to figure out, well, now, because of that raise, she was no longer income eligible to keep her kids in daycare. So here we are, the government, we know this, government knows this, is that we want to stick you in this box and keep you there. Because now she can no longer, she can't afford daycare. If you guys are single parents or mothers or fathers, that daycare is expensive, right? So these policies are written around, or these eligibility criteria, right? Oh, you don't qualify because you're not income eligible, or you don't qualify because you're not 62 and older with a disability. Oh, you don't qualify because you don't meet the HUD's definition of chronic homelessness to participate in our permanent supportive housing program. I'm not saying that those programs are not working. They are working. But I think we should lessen those requirements, right? Because my opinion is that the only way or not the only way, but one of the formulas to house the unhoused is what? Housing. Right? Housing is a component. It's not the only component, but it is a component. So what I would like to see is or build in the country is folks that are compassionate, loving, and kind. You can't go wrong with that. If you have those three things in your life, you just can't go wrong with it. So that's it. Thanks.
Okay, this was really, really good. We got about 2 minutes. Real good. And I thank you for your question, and thank you. So the takeaway is what? I need one person to do a 1 minute takeaway. What is it? What, Joseph? What, Kendall? Partnership. Change. Advocacy. Thank you.